Hello, so I am trying to enter the Northern Lights Medical Weight Management Program, so this is different than their surgical weight loss program. I just want some help to be able to maintain a healthier life and finally lose weight. And I don't know if I want to take all the risks that come with some surgery. I know I could always get more information. But I think I'd rather go this way. It's been a long, this has been over a year of trying to get set up. Because I've gone, to try to get set up, and then because I had depression, they needed confirmation from my doctor, and now because of COVID, they don't have as many people. But I finally got the packet to start filling out and getting connected with them. And this is the information session they make you listen to while you're filling out the paperwork. So,
hello, I'm Dr. Anna Welcome, a board-certified obesity medicine specialist here at Northern Light Eastern Maine Medical Center, and your host for this information session on our medical weight management program. I would like you to think about some of the reasons why you want to lose weight. Maybe you want to improve your overall health, prevent or reverse disease, reduce or eliminate your current medications, live longer and healthier. Maybe you want to be more active and enjoy your life more. How about setting a better example for your children or grandchildren? Maybe you want more energy or reduced pain. You may also want to like what you see in the mirror, have more confidence, and wear smaller clothing. Are you tired of trying to lose weight only to regain, finding yourself back at your starting point, sometimes with extra pounds? Do you wonder if there's a healthier way to manage your weight and stop yo-yo dieting? Have you tried diet after diet, exercised yourself to death, and still are battling your unhealthy habits? Are you starting to think that doing this alone is too difficult and that you might need some expert help?
For myself, as far as these questions go, are you tired of trying to lose weight only to regain? Yeah, I want to get back down to a healthier weight, and yes, I've lost a lot already, but I want to maintain that. I wouldn't say yo-yo dieting. I've been just trying to eat healthier. I also think the questions they ask, I want to give them more information. I might actually print something out that I read to tell them exactly what I've done and what I want to do. They say they'll find out a lot of this information in the first session. But anyway.
Here at Northern Light, our goal is long-term weight management and not another quick fix that doesn't last. We want to help people overcome the endless dieting cycle of losing and regaining, and help people to develop better habits and a healthier lifestyle that can last for the rest of your life. We hope that you'll consider taking this step towards a healthier life with the help of our obesity medicine multidisciplinary team. The purpose of today's session is to help you understand the risks of overweight and obesity, understand the benefits of a long-term weight management approach that emphasizes sustainability, understand some of the causes of overweight and obesity, and understand the necessary elements of our comprehensive long-term weight management program. Obesity affects every system in the body. This damage is from both wear and tear on our body from carrying the extra weight and from years of damage from inflammation of obesity. Some of the results of having excess weight are listed here on this slide. Unfortunately, this is only a partial list of what can happen to a body with extra weight. Diseases like heart disease, diabetes, high blood pressure, sleep apnea, joint pain, dementia, and cancers are just naming a few. The longer we have obesity, the more severe our problems from it can become, including a shorter life. To avoid disability and early death, The goal is weight reduction and maintaining that loss long term. Even a loss of 5 to 10% of initial body weight can greatly reduce medical risks. There are many benefits to losing that weight and then keeping it off, as you see listed here. I would like for you to think about how weight loss would improve your life and decide if it's time for you to start taking charge of your health. The frustrating truth about our biology is that battling excess weight is a chronic problem that for most of us will be a lifelong effort. The good news is that you have help. We're here to provide you with guidance and support as you change your lifestyle habits. Learning anything is usually more difficult at the beginning, but with time and lots of practice, the brain changes, making the effort easier. Just remember how you learned the habit of brushing your teeth. You weren't born with that habit, but you had help, guidance, and support initially, and after lots of practice, it became a well-established habit. Good habits may take time, but they're always worthwhile if we stick to it. The game-winning mentality for becoming healthier long-term is all about consistency. There are many reasons why people struggle with their weight. Each person has a different assortment of reasons. Some of these reasons include family genetics. Are there other family members who struggle with excess weight? Family environment. Did your family eat at home, eat healthy food, snack frequently? Culture. Did all social gatherings revolve around food, at home, at church? Medical history. Sometimes medical problems can lead to weight gain. Hormones. Changes in our many hormones can lead to both weight gain or weight loss. Psychology and behavior. Using food or drink for comfort. We might have developed unhealthy habits that are now difficult to break. Medications. Some medications that were prescribed may cause us to have increased appetite and gain weight. Life experiences. Big life events, both happy and unhappy, sometimes can lead to unhealthy eating and weight gain. At your first visit, we take a thorough history to better understand the reasons that you struggle with your weight. The better we understand you, the better we can help you. One reason that we all share for carrying excess weight is due to evolution. Our ancestors had to deal with food shortages and the risk of starving. But our ancestors had genes that protected them from starving. Others who did not have these genes starved and died and did not reproduce. Our survivor genes were passed down to us. These survivor genes resist losing weight and make it very easy to regain weight. This was good for our ancestors and kept them alive. About 150 years ago, the world began to change. Food became more abundant, easy to prepare, and had new and more fattening ingredients. Modern society also became less active. So now, in our modern world, our survivor genes are a problem for us, leading to excess weight for millions of people around the world. So what do? Are we doomed? There is hope. We are not doomed. We must learn, however, how to eat and behave in this modern world so that we, with our starvation-resistant bodies, can avoid some of these modern challenges and have a healthy body. We have to learn to eat smarter than our genes. We must learn to avoid triggering starvation mode, which causes our bodies to increase hunger signals and lower our metabolism, which reduces the numbers of calories we burn. Starvation mode prevents weight loss. That is not what we want. We need to work with our biology. How to avoid triggering starvation mode and manage our weight in this modern world are some of the things that we help you to learn. Successful long-term weight management has 3 essential components for change. Changes in all 3 of these components need to be present. These are nutrition, physical activity, and behavior and habits. We have to learn and improve our skills in all three of these areas. Think of these three components as the legs of a three-legged stool. They're all necessary for the stool and for long-lasting success and healthy weight. Anything less leads to temporary weight loss and yo-yoing weight. The first leg of this stool is nutrition. No big surprise here. All weight loss nutrition plans are lower calories. The plans can be low fat, low carb, Mediterranean, vegan, even ketogenic. You will only lose weight if the calories you take in are less than those that you are burning. The differences between these low-calorie eating plans have to do with the amounts and proportions of the macronutrients, which are protein, carbohydrates, and fats. Which plan is right for you? We help you to find an eating plan that is right for you and your body's needs. You'll need a healthy eating plan that you can see yourself continuing for many years to come. We help you to understand and control your physical hunger. Being hungry for the rest of your life is not an option. Physical hunger is your body saying that it needs certain nutrients for basic functions. It's also important to tell the difference between physical hunger and head hunger, so that you can know when you need to eat and when you do not. We need to avoid having many surplus calories because they lead to excess body fat. Everyone comes in with different knowledge and needs about nutrition. For those needing more help or education, we have very qualified dietitians to help. The second leg is physical activity. We know that physical activity alone is not sufficient to cause weight loss, but it is essential to weight management. So why is physical activity so important if we can't lose weight? Well, physical activity is critical for preventing weight regain. It's the barrier that holds back all those pounds from returning again. The activity needs to be regular and a sufficient amount to prevent that regain. Physical activity is the most important factor for us as we age to remain mentally and physically healthy and independent. We will help you to become more active, avoid injury, work within your limitations, and work with your preferences. We also have special physical therapists available to help those with physical limitations learn how they may become more physically active despite their barriers. The last leg of long-term weight management is behavior and habits. Focusing on understanding and improving our weight-related behavior and habits reduces the risk of relapse and weight regain. We will help you to learn, understand, practice, and reinforce better habits. You will start to choose healthier options and strategies to manage stress, anxiety, boredom, head hunger, and other triggers for unhealthy behaviors and eating. You will learn how to reinforce healthier habits such as physical activity and mindful eating. At Northern Light, we also have behavioral psychologists who specialize in weight management to help you replace bad habits with healthier ones. Your main contact on the team will be with the obesity medicine specialist, sometimes referred to as a bariatrician. The obesity medicine specialist is a physician or nurse practitioner, your big picture person who creates your plan of care, your main accountability person to help you stay on track, the first person you meet and takes your full history to understand your problem and set goals with you, meets with you regularly, assesses your progress, and adjusts your plan as needed, assesses whether additional tools are appropriate, coordinates care with dietitians, behavioral therapists, physical therapists, your PCP, and other specialists as needed, teaches you how to maintain your weight after loss. Beside the obesity medicine specialist, there are others who are available to help for those that need it. Dietitians. Our dietitians specialize in weight management. They can help with education, special diets, and help persons who need extra help with their nutrition plan. Behavioral therapists. Help patients understand their eating behaviors, manage stress and mood, provide emotional support, and support lifestyle change. Physical therapists. Help patients to become more physically active despite any physical limitations. Other specialists may include sleep medicine, cardiology, endocrinology, or others as determined by the obesity medicine specialist and the patient. And your PCP, who is a very important part of the team. Additional weight management tools, such as medications and weight loss surgery, are meant to enhance your work on the 3 essential components for weight management: nutrition, physical activity, and behavior habit change. Medications and surgery are not effective tools on their own and may not be medically appropriate for everyone. Your obesity medicine specialist will assess whether these tools are appropriate for you after you've started work on your 3 essential components first. How you are doing with adopting those lifestyle changes will give valuable information about whether these tools are needed, whether they would be safe for you, and which tools might be the best for you. This is something that we can only tell after we've gotten to know you better. When you feel that you're ready and motivated to get started, you'll want to get a referral from your primary care provider. It's important that you're getting regular medical care with your PCP. With weight loss, your health will be changing for the better, and it's important to share some of these changes with your PCP. Medications may need to be adjusted with weight loss. You will need to complete the forms that our office will provide to you. These forms include a medical and psychological history. This information will be reviewed by our providers. Occasionally, further evaluation may be necessary to assess whether this person may safely take part in our program. And secondly, a form titled 12 Reasons Why I Want to Lose Weight. This is an extremely important list to help you stay motivated and focused on your weight loss journey. Please keep one copy for yourself and send the other copy to our office with your other paperwork. We will discuss how to use this list for staying motivated. We are here for your success. Just like the story about the race between the tortoise and the hare, winning was not really about speed. Your success will really be about consistency. Losing weight with a fast but unsustainable method just leaves you back at the starting line again and again. It's time to change your mindset, try something different, and win the race this time. Here at Northern Light Medical Weight Management, we teach people how to be consistent, and we are ready to help you. We hope that when you're ready, you'll consider letting us help you on your journey. Helping people to achieve a healthier lifestyle is what we love to do. Hope to see you soon. Please call our office with any questions, and thanks for visiting our video today.
Okay, so that was that video. I did come up with reasons why for myself. And I was planning on printing it off and putting it in my binder, so. There it is. So reasons I want to lose weight is breathe better, keep up with my daughter, lessen my heart problems, more energy, avoid problems my dad had, confidence in myself. I want to be a role model for my daughter, wear smaller clothes, eat nutritious food, stress less, improve libido, and healthier in old age.